Nasaan na kayo, ma'am? Ma'am Ann.
Ano po?
Po pala meron na. Hindi ko po kasi kayo naririnig.
Ngayon, naririnig mo na ako?
Opo, ayan na po.
Okay na?
Opo.
Okay, so going back, nandito tayo, umpisa tayo. I just want to let you know what are the roles and responsibilities of the infection control nurse and our healthcare providers. So number one, as infection control nurse, she oversees, she is as ICN, she oversight overall infection control and prevention related activities within the organization. Okay? So she is the one overseeing all infection control and prevention related activities in the hospital or in the center. So she or he promotes the mission, vision, and values of the organization. Number three, required to establish standard methods of care utilizing evidence-based practice and best practice standards. So all of those, like the standard precautions and everything, it must be within the best practice standards and utilizing evidence-based practice. Number four is required to establish and implement infection control and employee health orientation program throughout the facility. You know, whenever a newly joined, staff is coming to join the facility, so she will be the one to implement the infection control, like orientation for those staff who are really joining. Responsible for policies and procedures within the organization related to infection control and employees' health. So, ensures compliance with local. When we say local, it is the Department of Health, and international requirements as in accredited bodies of the JCI, Joint Commission International, the ISO or the International Standard Organization, the CDC or the Communicable Disease Council, and the DOH policies and clinical responsibilities. Number seven, she or he participates as an integral part, collaborating with various departments and colleagues, including quality health, a quality officer, safety officer, HR, and others as needed to advocate her employee health and safety. She is participating with that integral team member, okay? So all of that, she is involving herself. Coordinates with the quality officer. She is coordinating always with the quality officer in the development and implementation of all employees' health initiatives and IC programs. All of these campaigns, all of these initiatives from the infection control, whenever there is like a breastfeeding month or breast cancer month, all of this, there is a program initiated between the collaboration between the quality officer and the infection control team. So number 9 is to develop alongside with the quality officer, IC, infection control policies and procedures for pre-employment and onboarding processes for employees. Those newly joined employees, we are going to train them or orient them regarding the hospital or the medical center policies regarding the infection control. All the policies, procedures, and guidelines to be oriented to the newly joined staff. In coordination with quality officer again for the management and notification of infection control related incidents like needle stick injuries. Like, you know, if someone among the staff, the clinical staff had accidentally pricked by a needle, a needle which was been used by a patient who has an HIV or something like that. So it is a serious problem within the healthcare facility. So we need to collaborate within the quality and the infection control to inform, to notify the infectious control health authority under the health authority. And then they will be the one to take charge regarding the treatment if treatment is needed. So responsible for all pre-employment testing and vaccination process. It is mandated. It is a mandatory for every clinical healthcare staff or the healthcare providers to have pre-employment testing in the center, not the one that we are doing for the screening of visa. There is another one mandated by the DOH to be done within the facility for all clinical healthcare providers to have this screening for hepatitis, for HIV, and if it requires vaccination, so vaccination is going to be given. Responsible for coordinating with the infection control program with the quality officer, which includes surveillance, analysis of data, developing reports, policies, and procedures. We have lots of performance measurement. Performance that it needs surveillance, it needs collection of data, analysis of data, and at the end, we have to develop a report and to be submitted as mandatory to the Department of Health. 13 is notification and reporting to authority for communicable diseases. Those communicable diseases are infectious diseases. And what are those? For example, we have tuberculosis, hepatitis, HIV, and what else? Those communicable diseases. So all of those we are reporting to health authority or the DOH notifying us that our patient who had like this has positive results. Coordinate with the Infection Prevention and Control Committee to determine the direction of surveillance activities and actively evaluate effectiveness of the infection prevention and control plan annually. So we have a plan. It comes within January. It starts with January for the whole year. So every month, we have that plan we are evaluating. Whether what we have done with the plan, is there any corrective actions for those plans if it is required? So all of those, we are doing it every month. This is monthly reporting. So works hand in hand with the quality officer in developing and implementing to continuously improve patient care procedures and control infection control mechanisms relating to quality, compliance, and infectious diseases. So participate in infection prevention and control education of all employees during orientation and annually thereafter, including training in infection prevention and control practices and employees' health. So we are not sending our staff to be trained to infection control. But since we have the infection control in charge or the infection control head, so she and the quality officer are going together to have the training outside. And after that, we are going to train the staff inside of the healthcare facility. So number one is to minimize, to less the cost, because each of the staff, if you will send them for the infection control training, you will be, costing each staff 200 to 250 dirhams. Wherein, if the quality officer and the infection control in charge are going, so we will be training them inside our healthcare facility. So this we are doing. So just like now, this infection control training or this infection control lesson that I'm giving you now is a part of this training that we are taking from outside. Okay, so we are updated. Uh, Number 14, coordinating with the Infection Control Prevention Committee to determine the direction. So we have that. In coordination, where are we? Works hand in hand with quality officer in compliance, participate. Ensure, number 17, ensure the infection prevention and control procedures meet local DOH, Department of Health locally, and internationally, the CDC regulation, standards, and guidelines. All our policies, procedures, and the guidelines which we are disseminating or developing inside of the healthcare facility, they are with, and they are under the standards, the standard requirements of the CDC and the JCI and some of the ISO. In coordination with the quality officer, the ICN organized Infection Prevention and Control Committee meetings, maintain all meeting minutes and reporting. We have, every time we met the Infection Control Committee, we have a meeting minutes, we have the minutes of meeting, and all of this will be reported, will be summarized in a month. If we have like every other 2 weeks we have meeting, so in a month we are going to prepare a report for a monthly summary of the meeting that had happened or the program, whatever is there that is done for the past. The roles and responsibility of the healthcare provider. Now it's it's turn of the healthcare provider. Responsibility or what are their role for the infection control. Number one, you have to be strictly compliant of the healthcare, implementation of infection control policies. So we are monitoring those staff regarding the hand washing. If ever we are initiating a campaign for hand washing, we are initiating a campaign for uh, um, PPE, for the use of personal protective equipment. So all of this, we are monitoring the staff compliance with our checklist. You know, who is complying, who is non-compliant, so all of this. And we are going to give a warning letter to those who are not compliant. So observe infection control practices at all time. So all of them, they have already the mandated, instructions that all these all these infection control practices must be observed at all times. Reporting of any incidents related to infection control to ICN. We have a process of reporting notification of infectious diseases or the incidences related to the infection control. Like for example, one staff has been accidentally pricked by a needle which was been used by an HIV patient. So this one has a process. So the staff who has been, accidentally pricked is going to make a report. From the incident report, we have a standard form to fill in. And then this notification report is going to the head nurse, and from the head nurse to the infection control nurse, and from the infection control nurse going to the quality officer for investigation within the incident investigation committee. So it's a long process. So updated immunization and vaccination. All of those clinical staff, like the all healthcare providers, they are updated with their immunization, their annual testing hepatitis and HIV, and vaccination. whenever the result comes as negative or below the normal, so the is to give or to administer a vaccine. Going to the chain of infection. So in chain of infection, this is a process. So how we are going to be infected, the infection. So there is a chain, there is a link within this infection chain, to create or to develop an infection. So how are we going to have this infection? Chain of infection is a process of infection that begins when an agent its reservoir through portal of exit and is conveyed by mode of transmission, then enters through an portal of entry to infect a susceptible host. So there is a process, there is a chain. So we should not break the chain. We will develop an infection. And chain of infection is a process, again, in which a favorable condition is required for microorganisms to spread or transfer from reservoir to a susceptible host. Okay? So now we have the chain of infection. How does the infection spread? How this infection get into another person. So the chain of infection is made up of 6 different links. We have the links. We should not break the links to make up an infection. So number 1, we have a pathogen. Number 1, from the link, we have the pathogen. We called it infectious agent. And the pathogen, which is the germ, cause disease. Okay, we have number 2, we have reservoir. This reservoir is a place in the it includes insects, medical equipment, and soil and water. The portal of exit. This is the way the infectious agent leaves the reservoir through open wounds, aerosols, and splatters of body fluids, including coughing, sneezing, and saliva. We have the mode of transmission. This is the way the infectious agent can be passed on through either direct or indirect contact, or ingestion or inhalation. Ingestion means once it is through what we are taking in. And inhalation means those that we inhale, like the microbes that has passed through the air. The portal of entry, the way of infectious agent can enter a new host through, that's the mode of transmission. So the portal of entry is agent can enter a new host through a broken skin. Like for example, you have a wound, and through that broken respiratory tract, this one also through the are talking about like the ventilators, the tubes, the oxygen. So all of those, they are the portal of entry where the infection set in. The immunocompromised patients, those mucous membranes, when those mucous membranes can be infected, so that will be a tubes. Long time catheters and tubes are already been with the patient for almost a week. So we have a protocol that it is at least 3 days to 1 week. That is the maximum time that we can change those lines and tubes. Susceptible host is the number 6. the new host. We are calling them the new host since it can be any person. The most vulnerable of which are receiving health care. Those inside of the hospital for a longer time. They are the susceptible host. Those person, elderly, old people who are having those chronic diseases like diabetes, hypertension, they are called immunocompromised patients. They are susceptible hosts. They have or those invasive medical devices, including lines, devices, the airways that they are using for those patients when they are giving anesthesia, those patients, ventilated patients in ICU, those are the hosts. Okay, so each link, these are the 6 in the link. And each link has a unique role in the chain. And each can be interrupted or broken through various means. So we need not break this to have an infection. But if and any one of these breaks, it means to say we are breaking the chain, so we are preventing the infection. This is the chain of infection that we. So 1, 2, 3, 4, 5, 6. It should be 6 within the link. Each link that causes, that results to one of those links, and it cause links will not cause or it will prevent you for having infection. This is the chain of infection and what we talk about. For those patients who has germs, microorganisms, they are agents that causes those are what else there? Fungi, bacteria, viruses, and parasites. So they are the one that causes infection. And going to who are the people, the reservoir where the infection lives. So these are the people, the animal, the soil, the water. So they are all coming from there. And for this portal of exit, when someone is coughing, you are meeting through the cough, through this airborne, those microorganisms are passing through or spreading to another person through air. And we have the germs that get around when you are coughing, you are sneezing, those mode of transmission, how they are getting into another person. And the portal of entry wherein these germs are going to be transferred to another through the mouth, through the cuts of the open wound, and through the eyes. And then reach the susceptible host, and then it starts to get infected. So now we know the chain of infection and how infection is being developed. So how to break this infection? How to break the chain of infection? So in breaking the chain of infection, or to prevent the infection and to save lives, we have to break the chain. So at any link which is going to be break, it's going to stop the germs from spreading. Okay, so we have to break the chain so we can prevent the infection and save people lives. Cleaning your hands frequently is number 1. Staying up to date on your vaccines, including the flu shot, covering coughs and sneezes, and staying home when sick, following the rules for standard and contact isolation, using personal protective equipment the right way, cleaning and disinfecting the environment, sterilizing medical instruments and equipment, following safe injection practices, and using antibiotics antibiotics wisely to prevent resistance. Because nowadays, especially those nurses, they are just buying drugs over the counter because they knew it. They know how to use it. So they are just, it is rampant. Over the counter antibiotic is being sold. So everyone can use it. But according to the CDC, the antibiotics should be used wisely or only with the prescription of the medical officer. How to break the chain of infection. So we have here, the diagram or the photograph of how to break the infection. So like for example, if you have the susceptible host and you have to, to do your standard precautions, so only then we have to break the chain of infection. I will not give you the full details, but I'm going to bring you this. Okay, so how to break the chain of infection. So breaking the chain of infection, we have the standard precautions. And standard precautions, they are set of infection control practices. It is used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non-intact skin, and mucous membrane. So number one in breaking the chain of precautions. So it is a set of infection control prevention practices. Okay, so what are those standard precautions? Number one, it is hand hygiene, hand washing, or hand sanitizing. So this is number one for breaking the chain of infection. Two, infection control prevention measures. Number two, the use of PPE. What is PPE? Protective personal protective. Okay, whenever expected exposure, use of personal equipment. Number three, we have safe injection practices. We will discuss all of this later. Number four, we have the safe handling of sharps and needles. Number five, we have respiratory hygiene, etiquette principles. Number six, we have the patient care equipment, instruments, and device. Seven, we have clean and disinfect environment. We have management of linen and laundry. 9, 10, ensure appropriate patient waste management and disposal. Immunization or vaccination. Sterilization of medical. So we have how many? We have 14. So they are sets of infection control prevention measures. So they are called standard precaution. Got it? Standard precaution is the of infection control practice, infection control prevention measures. Number one, we will discuss about hand washing and hand rubbing, hand hygiene. This is number one, the ultimate in standard precaution. So hand washing is also known as hand hygiene. It is the act of cleaning one's hands to remove soil, grease, microorganisms, or other unwanted substances. Regular hand washing is one of the best ways to remove germs, avoid getting sick, and prevent the spread of germs to another person. Whether you are at home or at work, wash hands when visibly soiled. In hand washing, Only wash hands when your hands are visibly soiled. This is one principle of hand washing. Only wash hands when visibly soiled. When you have seen your hands are soiled with dirt, so that's the time in a healthcare facility, it is a practice. When your hands are visibly, when you find there are visible soil in your hands, that's the time you wash your hands. But other than that, better use hand sanitizer. Okay? Hand sanitizer is the alcohol-based rub solution. Scrub your hands for at least 20 seconds. Okay? So wash hands when visibly soiled and scrub your hands for at least 20 seconds. Remember that. Wash hands when visibly soiled and scrub hands for at least 20 seconds. There is a time for hand washing. Proper hand washing is 20 seconds. How germs spread? Germs spread by touching your eyes, nose, mouth with unwashed hands. Prepare or eat foods and drinks with unwashed hands. Touch a contaminated surface or objects. Blow your nose, cough, or sneeze into hands, and then touch other people's hands or common objects. This is how we get the germs. Okay? So nowadays, even the handshakes, we are not doing the handshakes now. It is being banned by CDC and WHO. And instead of using the handshakes, we are calling it the elbow shake. Okay? So this is from the UNICEF. They have already from the United Nations, they already have implemented this, the handshake, the what is this, the elbow handshake. Okay, so because the handshake, since it is COVID pandemic, so they have banned it. So elbow handshake, yes, that is the elbow handshake. So the key times to wash hands. When do we wash our hands? Before, during, and after preparing foods, before eating foods, before and after patient care, before medication administration, before every procedure, after using the toilet, after blowing your nose, coughing, or sneezing, after touching an animal feed or animal waste, after handling pet food or pet treats, after touching garbage. So these are the key points when to wash our hands. So the 5 steps to wash hands, okay, we have the 5 steps. Wet your hands with clean running water, warm or cold, turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Timer? Do you need a timer? No. So just hum the happy birthday song and from the beginning to the end twice and you will get it done. Try it. Okay? So rinse your hands well under clean running water and dry your hands using a clean towel or air dry them. Okay? This is the 5 steps. If you wanted a little longer, there is 11 steps. Yeah. So this is the hand washing technique by the CDC. So hand washing technique with soap and water. I would advise you to print it or get it done from your online and keep it in front of your sinks so that whenever you wash your hands, you will always be washing accordingly according to this hand washing technique. Okay? In our lesson 4, for our practical exam or our practical, we are going to have number 1, hand washing technique. So with the return demo, um, I will mark your competency in hand washing. Okay? So with the hand washing technique, do it, learn it, practice it, put it in your sink so that you will get it perfectly done. Your 5 moments of hygiene. When are you going to hand hygiene? Inside the patient care area, we have the 5 moments for hand hygiene. Number 1, we have 2 before and we have 3 after. The 2 before is before touching a patient, before touching, before any procedure with the patient. Number 3 is after touching the patient, after every procedure, and after touching patient's equipments. So we have the 2 before and we have 3 after. These are the 5 moments of hand hygiene. Hand sanitizing. Hand rubbing or hand sanitizing. So use hand sanitizer frequently. As I said, only wash your hands when your hands are visibly soiled and wash it within or at least 20 seconds. Use hand sanitizer frequently. How to use hand sanitizer? The same thing with our hand hygiene or the hand washing. We have the process on how to use hand sanitizer. Apply the gel to the palm of one hand and rub your hands together and rub the gel over all surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. The same thing, it is 20 seconds. How to hand rub? Together with the hand washing, we have the process how to hand rub or the steps to hand rub. Nowadays, this is around nine process or 9 steps to hand rub. But nowadays, as it is being released by the CDC and by the WHO, they have released the 3 simplified hand rubbing technique. Okay, so there is a 3 simplified hand rubbing technique nowadays.